So welcome to today's 1-hour webinar. My name is Dr. Chudley Wirch, and I'm president and founder here at Prevention Plus Wellness, LLC, located now in beautiful St. Augustine, Florida. Beautiful and historic St. Augustine, Florida. And if you ever have a chance to come down here and visit, please look us up. I'd love to meet with you. It's a great place to visit. And it's the oldest continuously occupied European settlement in the United States. A couple of years even before Jamestown on the East Coast. So today's webinar, 1 hour CEU certificate, I'll send to everybody who's registered. And I'll send you a link to the recorded session today. And today's topic, as you can see, is sport and InShape, which are really alcohol, primarily alcohol and other drug prevention plus wellness programs. This is part of our ongoing series of free webinars we offer usually every week. And thank you for joining us. This is a full webinar, and I know we have people from across the US, so thank you for those of you joining us on the East Coast, all the way across where it's noon now, all the way to the West Coast where it's just 9 in the morning, and we are likely to have some people from abroad as well. Thank you all for joining us. I know you're busy. I know all the good work you do, and it's a blessing to be able to provide this for you and help you any way we can with the essential work that you're providing for youth and families in your communities throughout the country and world. So God bless you for what you do, and thank you for joining us for today. So 3 webinar objectives today. We'll have a whole hour together. We will need to cut it a little bit short. I do have another conference call at 1, so we'll cut it just a couple minutes short if you don't mind. But we'll stop before that for Q&A. But during the process, during the presentation, if you have any questions, if there's something not clear, something you want to ask, something you want to share as a prevention and health professional, welcome to do that. This is your hour. This is your group. And we have, again, people from throughout the country and probably world joining us. So feel free to share any advice, any suggestions, any problems you're having, and we'll look at those comments either in the Q&A section. You can post them there, or in the live chat. We'll look in both of those platforms, those spaces, at the end of today's presentation. So we'll have plenty of time for Q&A today. So 3 objectives for today. First of all, we're going to look at the manual contents and steps for implementing and evaluating the single session evidence-based sport and InShape prevention plus wellness programs. Now, sport, for those of you that don't know, is our youth-based program. It comes in a high school, middle school, and elementary school version. So we'll start looking at the high school version. If you want to see some of the elementary or middle school, let me know that. I could show some of those slides, but my intention is to really focus on the high school sport, and then also maybe contrast that to the InShape Prevention Plus Wellness program, which is for young adults, whether that's in college and community and military settings, whatever the case may be. So we'll start with sport high school, and then we'll contrast that a little bit with the InShape for young adults. These are both evidence-based prevention plus wellness programs. That means they've been rigorously evaluated in a number of randomized community trials. The outcomes have been published in scientific journals, and then and only then have these 2 interventions been placed on a number of evidence-based registries like NREP, the now defunct NREP, Blueprints for Healthy Youth Development, etc. So you can learn all about that, the research, the registries that these programs are on, all of our evidence-informed programs, which are spin-offs from these programs, including the vaping, marijuana, opioid PPW program in God's Image, Sport 2 PPW, which is our 6-session program, and even our latest program, which just came out earlier this week, which is our Racial Justice Prevention Plus Wellness program. You'll learn more about all of those if you're interested, on our website, preventionpluswellness.com. Okay, so that's what we'll focus on first, the content. Secondly, we'll take a look at the PowerPoint slides so you can see how the slides work in the implementation process. And you can implement all of our programs both in person as well as online, which I'm sure many of you are going to need with the continuing pandemic. And thirdly, we'll take I don't know if we'll need to look at the reproducible materials. Let me just say this, that if you order any of our Prevention Plus Wellness programs, you get a physical manual for the most of them. You'll get an actual physical manual with protocols or scripts to provide them to young people individually or in a group. And there are new protocols now to provide them online. So they're very feasible, single session for the most part, and can be provided online. You can expand them to multiple sessions if you need to. We cover all of that in our 2-hour live online program implementer training. We also have train the trainer online. We also have youth training. In other words, we could train youth to implement these evidence-based, evidence-informed PPW or Prevention Plus Wellness programs. And all of that, you can learn more on our website, preventionpluswellness.com. Okay, so one more time, for those of you that may have entered the webinar late, I will send everyone an email at the end of the day, before the end of today, unless something comes up. And that email will include an attachment for 1-hour CEU certificate that you participated in. And it'll be a link to the recorded session if you want to share this recorded session with others. So if you need something else, if you want something else, you could just let me know by placing your request in the live chat or the Q&A option here in today's session. And you could also respond to the email I send you. By the way, if you don't find your email from me at the end of the day, check your spam folder because it has an attachment. Sometimes these emails are sent to your spam. Okay, so let's start today's session with a poll. And I think the poll, I'm going to launch it right now. The poll will help us understand who's online today, who's participating, and help me sort of focus a little bit or tailor the webinar a little bit to your needs and your interests. So you're going to see in front of you in just a moment 3 questions. I'm sure you'll have to scroll down to get to all of them. But when you see them, please take a moment and answer the 3 questions. The first is, what age group or groups are you most interested in when you provide substance use prevention plus wellness programs? You could answer more than one response to that question. And then scroll down, I should say, to question number 2, which is, what prevention program characteristics are most important to you? And again, you could answer more than one. And lastly, the 3rd question all the way down at the bottom of the poll is, what prevention program implementer training options do you most prefer? Now, for those of you that are checking other, let's say you're checking other in terms of the training options. Let's say you're checking other for characteristics of prevention programs that you're looking for. I would really, really appreciate it if you would respond what you mean by other in the live chat or the Q&A section. Now, by the way, I'll just tell you where the live chat is. If you have problems finding it, it's on your toolbar, your Zoom toolbar, under the, I'm not sure what that is, more heading. And it has 3 horizontal dots. You click on that and you'll be able to find that live chat. And then you'll be able to type in what you mean by more. What is it that you're looking for in terms of other, I guess it is not more, other things in terms of characteristics of prevention programs you're interested in or training options you're interested in. I'd love to have you respond to those. If you've clicked on those others, respond in the live chat space. Okay, so we've got almost 60%, we got over 60% that have responded to the poll. I'm going to wait just another minute or 2. I'd love to get that up to 70%, 80%. The more of you that participate, the more that we'll understand who's online with us today and what your needs and interests are, so we can tailor the training to what you want to hear during today's session. So please do respond. It just takes a minute. I know some of you can't respond. You may be on just listening to the webinar, but for those that are viewing this webinar, I'd like you to respond. We're right now up to 7 and 10, or over 70% have responded. That's awesome. Let me just give it another 30 seconds so that everybody who wants to respond can respond. I see Jennifer has raised her hand. I bet you that's just an accident, but I'm not gonna click on that right now because I don't want to mess up the poll, Jennifer. And Kim has raised her hand, so we'll come back to those in just a minute. So we're up to 75%. 3 out of 4 of you have responded. Just another few more seconds for those of you that might want to respond. And I appreciate everybody taking the time to answer these 3 brief questions about what your interests are in terms of training, in terms of program characteristics, and the types of young people you work with. And there we are, 80%. Woo! We did it. So I'm going to lock it in at this point. I'm going to end the polling and I'm going to share the results with you. And so let's take a look together at how everyone responded. Again, thanks for responding to this poll. So question number 1, what age group or groups are you most interested in when providing prevention plus wellness? Middle school was the most common, and that's followed by high school and elementary school. Some of you are also working in the young adult area, and adults, and even older adults. So what we'll do then is, let me just change this a little bit. So what we might want to just take a look at is sport. Actually, I should probably, well, let's just start with sports, high school, and then we'll take a look at middle school and elementary school. The InShape is for young adults. Not too many of you are focused on that right now, but we'll try to fit in a little bit of a quick view of all of those if we can, and most of those today. So I think we've got enough time to do that. So thank you for answering that. Question 2, what program characteristics are you most interested in? And I think the winner there is evidence-based or evidence-informed. Of course, these 2 programs we're discussing today, sport prevention plus wellness for youth, InShape PPW for young adults, are both evidence-based. And by the way, both of them, as well as all prevention plus wellness programs, follow an evidence-based practices screening and brief intervention. So all of them could be considered evidence-based practices according to SAMHSA, or the Substance Abuse Mental Health Services Administration, as well as other health organizations throughout the country and world. So let's see, that's followed by, evidence-based is followed by, lots of you are interested in, can be provided in person and online. That makes sense, certainly because of COVID-19, as well as focusing on healthy behaviors. That is that's the wellness component to prevention plus wellness, is substance use prevention, plus the promotion of wellness behaviors, physical activity, nutrition, sleep, stress control, all important to preventing chronic diseases and promoting wellness, and even preventing substance use. Brief and easy to implement, all prevention plus wellness programs, with the exception of Sport 2, are just a single session. Sport 2 is actually 6 sessions, but they're flexible enough to expand to multiple sessions if you want to. And then you also responded to other things that you're interested in. The thing that you were least interested in, it looks like, includes free analysis of pre-post surveys. Okay, and that makes sense because we don't get a lot of requests for that, but we do offer that free service, and we do have built-in pre-test and post-test surveys so that you can evaluate your program, each program lesson. Some of you, looks like a small percentage, also checked others. We'd love to hear from you. If you could write it into the live chat or Q&A, what are the other characteristics you're looking for in your prevention program? Last question, what prevention program training options do you prefer? And the winner is, oh, it's a tie actually. I love it. So this is the first time I've seen this. in-person training, makes sense, but then also webinar training, same amount. So of course, in-person training really difficult at this time. If it can be done, that's, there's some advantages to that. Particularly, you could practice together in your training. And what we like to do is we like to train other providers to offer those trainings in their location. So we do have an online train the trainer. So that's an option. We also go out and do training in person. We haven't since COVID-19. But hopefully once the pandemic blows over, or once we get a handle on it, have better control over it, we will be able to resume some of that travel and come to you. But if we could, I would prefer it. And I think most organizations and regions prefer to have their own people provide the training live, and that's why we that's why we offer train the trainer. And currently we offer live training, and we offer in webinar training, and I say those are almost the same. And so we offer that for program implementers and for train the trainer. So I'm going to stop showing the slide. Thank you all for participating. And that helps me understand what your needs and your interests are. Let's take a look. You know what? Let me switch out, because most of you are interested in the middle school sport program. Let me listen to what you're saying, and let me go ahead and show you that program, because that's what you're most interested in. So let me just, if you'll just bear with me, I think this will benefit you because of your interest. We're going to take a look at the middle school version. That's the young adolescent version of the Sport Prevention Plus Wellness program. So what we're going to do is I'm going to pull up, if you'll just bear with me, I'm going to pull up the manual and we'll take a look at that. And then we'll also take a look at the PowerPoint slides. So because of, you can only put so many of these, so many programs, flash drives in your system at one time. I have to switch one out with another. So that's what I'm doing. So let's see here. I'm going to pull up the middle school version of Sport. Again, this takes a little time. If you'll just be patient with me, I think it'll benefit you because that's what you're most interested in, at least the majority of you. So we're going to take a look at that. And I just about have it lined up here for you. Okay, so I've got the manual up in here. I'm just adjusting the size of it. Sometimes these things take a little bit of time, and I'm almost there. All right, so let me show you the program manual. Thank you for bearing with me and allowing me to switch that up. So this is the Sport Prevention Plus Wellness program, middle school or young adolescent version. This is the 2020 manual. Looks like this is this color, great looking young people on the front of that. And so let's take a look. I'm going to walk you through the manual. We'll take a look at what's in the manual, how to implement this, how to evaluate this program. So it's going to be a good overview. Now, what is the difference between the high school, the middle school, and the elementary school versions of Sport? Largely, it's the imaging. Largely, it's the illustration. So, for example, you got the young adolescent version. You've got those young kids. If you've got we've got the high school version. They're a little bit older looking. Obviously, the elementary school version, you have the younger kiddos in that. And so that's a key component. Of course, the elementary school version is also a little bit easier to understand, to respond to. That's another main difference. Other than that, the content is the same. The program is the same. So for example, for content, you have the same 8 sections. So let's take a look at what they are. The first section is a description, an introduction to the program. You could also read the same description or introduction to the program on our website, preventionpluswellness.com, under the heading of programs, and go to sport, and you'll be able to read that introduction description of sport. Second section, step-by-step implementation, directions for implementation. We also provide separately a 2-hour live online training for program implementers. It's optional. We highly recommend it. We found it to be critical for implementation success, perhaps even more now than ever, because we do walk you through how you can provide your program not just in person individually or one-on-one, as well as in a group of youth, but also online. Third section is the screening survey and goal plan contract. So I'm not sure if how many of you know this, but Prevention Plus Wellness programs, I think I had mentioned this already, are evidence-based practices, screening and brief intervention. There's 3 components to each of the screening brief interventions. First step, screen youth for their current health habits, not just substance use. And in case of sport, it's really alcohol use. In case of InShape for young adults, it's alcohol and tobacco. So that's the focus, but also, not limited to that, also assessing physical activity, sports, nutrition, sleep, and even stress control. Those are the behaviors that are assessed. Why are you asking youth about their health habits? Why are you bringing those up? That increases their awareness of their current health behaviors, and that's the focus of the feedback. That's step number 2, providing feedback on each of those behaviors, and using positive image terminology and benefits will cue desired future images of young people automatically. So using the terms like fit, active, successful automatically will trigger unconsciously positive images of young people, desirable images that increases motivation for change, especially motivation to set goals to improve wellness and to avoid substance use, which counters or hinders that successful behavior and image attainment. And that's step 3, goal setting. Goal setting, not just to avoid substance use, but to engage in healthy behavior. So that's why section 3 includes a screening survey and goal plan. They're critical components of the strategy and of the program and of the lesson. These tools, screening, survey, and goal plan, are also in your digital download. So you have a digital download along with your physical program manual. We're looking at the program manual now. But your download, you can just copy it to your computer or any device, includes your PowerPoint slides and all your reproducible materials like your screening survey and your goal plan. I hope this makes sense. If it doesn't, ask us a question in the live chat or the Q&A option, and I'll be happy to answer it toward the end of today's session. Section 4 is the script for providing your program one-on-one, and section 5 is the script provided in the group, and section 6 are online protocols that'll help you provide these programs not just in person, individually in a group, but also online, individually in a group, in a video, as well as by telephone. And as I said, we offer 2-hour live online training, and we can discuss those protocols and how to provide your program in person or online. In fact, if the training is just of your organization, or if just a couple of you, we can tailor that training to what your needs are. Section 7, evaluation tools, including the pre-post survey, as I had mentioned earlier, but some other process measures. And lastly, I think very importantly, a separate intervention altogether in your sport program. It's follow-up parent letters. Some organizations will use these flyers, these parent flyers, or it's a letter to parents, and then 4 weekly flyers, and they can be handed out, mailed out, emailed, posted on your website. A completely separate intervention. You could use it or not use it. The key intervention here with Sport and InShape and all PPW programs is the three-step screening and brief intervention: screening, feedback, and goal setting. So that's the main intervention. In sport, you also have the second intervention of flyers to parents, and that's absolutely separate. So we did one study of just the flyers. 3 of the 4 flyers found to be effective in reducing and preventing alcohol and marijuana use. So it is a good intervention, but it's up to you as to whether you use it or not. You can use it as a follow-up to your communication with your youth. The idea behind the flyers is to get parents to provide the same positive image communication that you're going to be providing to them in the brief intervention. So again, the flyers can be used as a secondary intervention, a follow-up intervention, whatever you want, and we can discuss more of that during the online training with you. So that's the table of contents. A lot of stuff here. You get the program manual. You have the protocols. So you have your manual in hand, and you have your digital download of all your reproducible materials. You make copies of whatever you need to implement it. So if you have 10 kids you're going to be implementing this middle school program to next week, make 10 copies of your screening survey, 10 copies of your goal plan. You bring your PowerPoint slides along with you. You have your manual in hand. You're ready to provide it. And again, that can be done in person or online. And online could be Zoom or whatever video conferencing platform you use. Let's continue through the manual so you can get a little bit more of a sense of what are we talking about for those of you that haven't been introduced to the programs in the past. So again, this is the middle school version of sport. We have a high school and elementary school. Section 3, the screening survey and the goal plan contract. Let's take a look at the screening survey. This is the first step, the first part of the intervention. You're going to screen youth and they're going to self-assess their health habits. Notice the first question is about sports physical activities they played in the last year. So they go down along the list. If you're going to provide this in person, you can make a copy of the goal plan. If you provide it online, you could have them complete this, I should say, the screening survey on a blank sheet of paper. It works either way, just fine. So they assess their physical activity in sports in the last year. It goes back a whole 12 months. There's a long list of activities. They could even write in some others, including regional sports or activities, including chores, like mowing the yard, cleaning the house, and so on. So they give them a lot of credit for doing anything physical. The second question is, now, by the way, this question is on the high school version, middle school version of sport. The elementary school version is just a yes or no question, just to make it simpler for the elementary school kids. So that's the difference between the 3 versions. The second question is, I think, on all 3 versions of sport. Actually, I take that back. This, yes, it is. I'm sorry. Yes, I had to just think there for a moment. So the second question is about regular physical activity, sports defined as 30 minutes, 4 or 5 times a week. For example, riding a bike, running, walking, etc. Answer yes and no. So yes, this is a question on the high school and elementary school version of sport, as well as this middle school version. Third question is, do you usually eat a healthy breakfast every morning? For example, there's some examples of that. The answer yes or no. So you can see we're addressing sports physical activities in the last year, regular sports physical activities, healthy nutrition. And lastly, fourth is sleep. Do you usually sleep 8 or more hours each night? Yes or no? And then lastly, a question, only 5 questions, about what best describes your alcohol use. So sport and InShape focus largely on alcohol use. This was because it continues to be the most prevalent substance of use among young people. And but having said that, in our trials evaluating sport, we found it also to be effective, even though it didn't address it originally. Our sport program also not only found to be effective in preventing, the onset and different levels of alcohol use among young youth, also had an effect on tobacco use, cigarette use in particular, and among drug users on marijuana use. and some of the effects even a year later after this one single session. Whereas InShape had a significant impact on alcohol use, including heavy use, marijuana use, including heavy marijuana use, and drinking and driving, with some effects a year later. So even though these programs focused largely on alcohol, the effects were beyond alcohol, included other substances. Nevertheless, we had a lot of organizations throughout the country say, hey, we would love to have a sport type program that addresses vaping, e-cigarettes, and cannabis, and opioids. That's why we developed these modifications of the Sport and InShape programs, and that's why we have the marijuana prevention plus wellness, vaping PPW, opioid PPW, etc. So with the middle school version, the question 5 is a staging question. We're trying to get at where are they at with regard to the acquisition or initiation of their alcohol use, from A, never tried it, never will, to F, that they've been drinking in the last 6 months. The question at the high school level is a little bit different because a greater risk, we're actually asking them about the number of drinks they've had. And for the elementary school version, we just asked them if they've ever tried any alcohol, yes or no. So that's the difference in the screening surveys for the different versions of sport. In terms of the goal plan, this is the third part of the intervention, screening them for the current health habits, feedback on those behaviors, and then goal setting, which is the self-regulation piece, the self-control piece, so critical. And it also initiates behavior change. Remember, well, or for those of you who don't know, all prevention plus wellness programs are motivational. They're motivational screening and brief interventions. There's more literature on showing the effectiveness of screening and brief interventions than any other type of program or intervention that we know of. And so the focus is on more on motivation than on education. There's some education involved, certainly. Youth are learning how these behaviors connect with each other, how wellness behaviors promote wellness and help prevent substance use, and how substance use interferes with wellness behaviors and benefits and outcomes. But largely, the idea is to motivate them, to let them think about their health habits, motivate them with the feedback, and then capitalize on that by initiating the behavior change process, and them learning to start regulating their own habits by setting goals, monitoring them, and then changing them over time. So that's the process. So it's very, very motivational. So you can see that with the goal setting, the focus isn't just on avoiding alcohol and other drugs under number 4, but it's also to promote overall healthy habits that are discussed in the sport program, including sleep, breakfast and other nutrition, especially fruits and vegetables, and lots of activity, sports and otherwise. And to do that, we want them, in the middle school version, we want them to identify perhaps somebody at home that could co-sign the goal. That will increase motivation for change if they have someone. And to set a wellness goal. By the way, that we're also having them pledge to avoid alcohol and other drugs in the next 7 days. And then also in the next 7 days, what's the one wellness habit they want to continue or to build on? Has to be measurable, achievable, and then you're going to identify the quantity and the frequency that'll make sure that they could monitor it. And then co-signing it, very important, that increases motivation, and then a congratulatory statement and some really good directions that'll help them sort of improve the possibilities of success and continue to develop that self-regulation behavior over time. So if you're going to implement the program individually, either in person or online, you'll follow the individual script. Here is the individual script. Literally, it is a script. The beauty of the script is that it's going to increase fidelity and reliability across time, across implementers, across settings. You follow this script, it's going to be the same program. That's the beauty of the script. And so that's why we have it. And so you have an introduction, you show a slide, and you literally follow the slides. And so because of the brevity of the program, what you do is if you choose to take our training, we'll walk you through this in more depth. And then you practice on your own, and then you're ready to go. So practicing the script makes it familiar to you, comfortable to you, and then you don't have to look down at the script and read it. You can look up at your youth, individual youth, or your group of youth in person or online, and you can present this in a natural fashion. So practicing the script becomes important, but notice the script has an introduction. And again, now this is the script for providing it to just one youth. Then you're going to screen a youth for their current health habits with the screening survey, which we just looked at. That can be done again in person or online. And then you're going to provide feedback. Now the feedback follows the items in the order that they're shown on the screening survey. So the feedback, first of all, is about sports and physical activities last year. So if you present this to one youth, you're going to look at how they answered that screening survey. Or if it's online, you're going to ask the screening survey again, which is shown right there in the slide, and they could answer yes or no whether they've had sports or physical activities in the last year. If they say yes, you're going to read the yes response. Yes is good, green, go, they've gotten some sports. And so it's going to be tailored to them. In other words, so it says here, oh, I see you do some sports that you've listed on your screening survey or that you mentioned verbally. And so sports and physical activities are a great way to get regular exercise. So you're going to say, good for you, congratulations, you're doing sports. Here are the benefits of sports, here are the positive images. That increases motivation for change. That's also shown in the slide, in the picture. The picture shows different, both genders, different ethnicities, different activities. Those slides can be changed and can be tailored, and we discussed that during the online program implementer training. If you need to change those, I'll give you just one example. We did have some people in Montana that changed the slides, took out these pictures of organized sports like basketball, baseball, football, track, and put in outdoor recreational activities that are much more common in Montana, like hiking and skiing and fishing and that type of thing. Perfect adaptation or customization in that setting. So we can help you with that customization during our training for program implementers. But the first messaging and the two-step messaging process is highlighting the benefits, and particularly those positive image terms like healthy, feel good about yourself, energy, so forth. And then the second messaging, which is how substance use harms that wellness behavior, is shown in the second slide. However, alcohol and an active lifestyle do not mix. So this is the feedback that you provide. If the young person said, yes, I get physical activity, I got physical activity in the last 12 months. If they said yes to that first item, that first question in the screening survey, yes, again, is highlighted by green, good, go. If they said no, then it's the no response. It's highlighted by red, sort of a warning or higher risk, and you'll read this response. So you read one or the other response. You won't read both of them. And so same content, same slides, but a little bit different feedback. I see that you may not play sport or physical activity. You can really improve your health and how well you feel by being more active. So you can see the feedback is either positive or it's neutral, nothing negative, don't want to turn off youth. And so that's how you provide the feedback to that single youth, whether it's in person or it's online. And then you'll continue to follow and provide feedback about regular physical activity. That was the second survey question. And again, either yes or no. A breakfast question, yes or no. If they said yes, you read the yes response for feedback. If they say no, you read the no response. And so this is how you provide the feedback all the way through, including all the way through the alcohol responses. And the alcohol responses are tailored to where they're at with their stage of initiation. So if the stage is at the very beginning, so they're, for example, They're not thinking about using and never will. That's a green response, low risk response. You'll read that. But if they answered something down in the list of responses like they haven't drank, but they probably will as an adult, that's a yellow response. That means there's a little bit more risk. And of course, in the end, toward the end, you're going to have a higher risk response. And the highest risk response was that they checked, yes, they've been drinking in the last 6 months. So that response is a little bit different to address the fact that they're a little higher risk. And then of course, at the end, you provide the goal plan contract. So that's how that's the script you use if you present this to one youth in person or online. If you're going to present this to a group of youth in person or online, you'll use the group script. What's the difference between the group script? The group script has an introduction. It's the same thing as the individual script. You're going to have the group complete their own screening survey. That's the same. But the difference is when you provide feedback, and here you're going to start providing the feedback with the sport, physical activity last year, it's going to be more generic. It's going to be to the group rather than to an individual. So a little bit more generic, and yet still there's going to be some interaction here that's built in, and I'll show you that when we take a look at the slides. So that's the difference between the one-on-one or the individual script and the group script. You're going to provide the same slides regardless. The content is pretty much the same. Goal setting is the last thing. There's also an interactive exercise, an optional second a lesson, if you will, if you present this to a group. And then you have remote protocols to provide your sport program to online to one youth, online to a group of youth in a video, or even by telephone. And we have built-in evaluation tools. We have a screening survey, which comes in two formats, scannable form as well as an online form link. So regardless of how you present your program, you can collect data to assess how well students respond to and what the effects are for your individual sport lesson. And the measures are behavioral intention across all of the targeted health behaviors, not just substance use and not just alcohol, by the way, cigarettes, marijuana, e-cigarettes, other illegal drugs, and all the healthy behaviors, physical activity, nutrition, sleep, stress control. Behavioral intention is the most highly correlated and predictive measure of future behavior. So we're measuring that. And then we're measuring also perceived harmfulness or susceptibility, also very, very much predictive of future behavior. And of all of the substances, 5 of them, not just alcohol, cigarettes, marijuana, e-cigarettes, and other illegal drugs. That's the pre-test. The post-test is implemented immediately after the lesson. So you get a pre-test that you provide before the lesson. Post-test you provide after the lesson. Also includes a couple open-ended items. And there you have it. You've collected your pre-post assessment so that you can get feedback as a prevention specialist on how well you did with providing your program to your youth. So it's a great, great tool. And again, we do provide a free initial analysis, which we call a Prevention Plus Wellness Report Card, or you can look at your data and analyze it yourself. You can use these scannable forms, and we also have links to online forms. And we can customize the link and send it to you so just your organization has your own pre-test and post-test link, so your data will be separate from everybody else's. We also have an instructor survey. That's a process assessment of how well you implemented your program, as well as a fidelity checklist. And lastly, if you do send out the parent flyers, here's a protocol to call some of the parents or all of the parents, it's up to you, and ask them if they received the flyers, did they use them, did they talk to their kids about them. A great, great tool to assess how well you're reaching the parents and how kind of an impact it's had on them. So that is the manual. And of course, lots of content in the manual, and as well as the digital download. These are the PowerPoint slides. I just wanted to show you them very quickly to take a look at them. This is a slide. Again, this slide can be co-branded, or you can put your organization's name on it, colors, logo, and we discuss all of that in the 2-hour live online program implementer training. The slides cue you and they follow the script so you can, everybody knows what's happening, what's coming up. You're going to complete the health and fitness screening survey. Here are the screening survey questions. It's great. So if you're presenting this online like we are right now with Zoom, all you have to do is you have youth complete the screening survey on a blank sheet of paper. If you do it in person, you can make copies of the screening survey and distribute it. Then after that, it's going to review or repeat the screening survey question. The first one was, what sports, physical activities did you play in the last year? And then the feedback. Sports and physical activities are keep you fit and healthy, very powerful image terms and other benefits, but alcohol and drug interferes with that. Then there's going to be a repeat of the second screening question. Did you participate in regular physical activity, 30 minutes 4 or 5 times a week, for example? There's the feedback highlighting the benefits of regular physical activity. There's a discussion question. So we have for the new manuals, for the new slides, we have built-in discussion questions, which is really important if you present this in a group or online. So you have more interaction and you get youth to think about themselves. How does this relate to themselves? So the question is, what types of sports or other physical activities would you like to try? Something you've always wanted to, never had time to, or that you want to do more of. So you're going to take it back to their lifestyle, to their life. And so that's why we have built-in discussion questions. And then here's how alcohol and drugs interferes with that lifestyle and so on. So there's the feedback and the discussion questions. And then you're going to get to eventually stating to be healthy, to be active, to look and feel good. Obviously, avoid alcohol and other drugs, but engage in these wellness behaviors, and now complete a goal plan contract. So you could hand out the contract if you're in person, or you've got an option here, because what we've done is we've built in slides of an alternative goal plan contract. And so here are the slides. You want them, first of all, and they can do this on a blank sheet of paper. You could have them pledge to avoid alcohol and drugs. They could write yes or no. And then they could pick one of these areas, one of these 4 areas to write a wellness goal. It could be sleep, it could be breakfast or nutrition, it could be activity, it could be stress control. And then they're going to write that goal. It's going to be specific and measurable, quantity, frequency. By the way, we also have an online goal plan. We could send you a customized link, and you could show the link during your online presentation, just like the pre-test and post-test. They could click on it during the presentation and complete it right then and there with you, so that you can have your youth do a pre-test, a goal plan, and a post-test within your online lesson. And then including, again, the congratulations comment, and that's the end of the lesson. You've completed your lesson. If you want to, you can have a built-in pre-post test as well. You can provide your programs in person and online. How does this differ from well, a lot of you weren't really interested in the young adult. I will just tell you that the InShape PPW program, the young adult program, has a little bit more content. There's a section on stress control, so a little bit more on that, a little bit more information, so there's a little bit more slides, so there's a little bit more education going on with the young adult version, which is the InShape Prevention Plus Wellness program, which has been used and implemented to college students, universities, in community settings. Even the U.S. Air Force is using the InShape Prevention Plus Wellness program. I'm going to stop at this point. Covered a lot of content. We've got about 10 minutes left. Let me see what kinds of questions or comments that have come up during the presentation. And let me know if you have any others. You could add them right now. So where do I click to download? Not sure what that's about, what you're talking about, Victoria. Let me know if you could help me understand what you're asking there. How do I get my digital copy? Well, your digital download, when you purchase your program, we'll send you a program manual, and then your download will come as soon as you make the purchase. So it'll be sent to whoever ordered it. If you can't find it, that means that you probably haven't paid for your materials yet. And typically, most organizations will order the online training, and then when we discuss it online, if you don't have your digital download, we could send it to you. And so if you've ordered your materials, you paid for your materials, and you don't believe you have your digital download, you can't find it, you've lost it, whatever the case is, I would say go to the person who's ordered it for you, but you could also just shoot me an email, and I'm happy to resend the link to you. But make sure you copy it to your computer for safekeeping, because if you lose it, it's going to be a problem for you. So it's yours. Copy it for safekeeping to your device, your computer. A great question from Anonymous, which is, what's the time commitment for teachers for the program? The time commitment is flexible. The sport program can be implemented in as short as, I'd say, about 35, 40 minutes, and you can go as long as you want. It depends on a number of factors. For example, how much time you spend on the discussion questions, and who you have respond. It depends on the size of a group versus an individual. So if you implement it to one individual or to a handful of kids versus a class of 20, 25, 30, that's going to increase the time for implementation. How much time you spend on the open-ended part of your training or your implementation, which is the goal setting, will also be another factor. So sometimes it's actually a balancing of how much interaction you want, but also watching your clock, because you've got to limit the time that you might have for implementation. But you should be able to provide this sport program within any 50-minute, 45, 50-minute period. And that would include, in most cases, being able to collect your pre and post tests as well. So I hope I've answered those, but if not, feel free to ask again. Let's take a look at the live chat comments and questions, see what people are saying here. Good afternoon. Let's see here. Can we have elementary info? Yes, thanks for asking that. I'll pull up the elementary here in just a minute and let you take a look at the slides at least. And while I'm doing that, I would say that we also can provide you with a sample, electronic sample of any of these programs if you're interested in taking a peek. So all you have to do is send us a request at info at preventionpluswellness.com, and or just respond to the email I'm going to send you. Say, hey, I'd like to have what they are is redacted electronic sample. So I'd like to have a sample of the elementary school version of sport or whatever. We could send you a link to that. So let us know, or you can go to our website, preventionpluswellness.com, and at that site, you could text us as well, a request. Good evening to all. Somebody's calling in from another part of the world, I think. My other, let's see, my other represents my suggestion of spiritual, not religious, and incorporating nature into wellness. I'm not sure, Mary, what you're talking about there. I think that you're onto something really important. We do have it in God's image, by the way, which is our spiritual religious version of Prevention Plus Wellness programs. You may want to look at it. It's under the programs heading for Prevention Plus Wellness. Are we doing the pre-test, post-test on the same day? You're doing it at that lesson. You're going to, so that there's no need for follow-up, very efficient, very effective. You're going to do a pre-test. You're going to implement your lesson. You're going to do a post-test. You have it then and there. It's all done. If you have your scannable forms, you can scan them and send them to us for an analysis. If you have them completed it online by clicking the links to the pre-test, post-test, the data will already be collected. So all right then and there, very, very efficient, very practical. Can we get access to the online link to be sent out when doing the program virtually? And does that have an additional cost? So there is no online link to provide your program virtually. What you have is the same program, the same manual, and the same slides, but the new slides, the 2020 program and slides, are adjusted to include, number one, the protocols to provide your program online, and two, the slides have been adopted and adapted, I should say, so that you could provide your programs easier online. So for example, we have the built-in goal plan on the slides. We have the screening survey questions on the slides. We have discussion questions on slides. So that's how they've been changed so that it can be presented online. And then really, if you've been implementing our programs in the past, and if you've had training, you may want to have a refresher training specifically designed to implement the program online. I'll tell you also that we have, if you go to our website, preventionpluswellness.com, under training, schedule of training, we do have a 1-hour recorded online strategies to implement our program. But the key is to really have the more recent version of the program and the slides, and then to get some training, whether that's viewing one of our recorded sessions or ordering up the 2-hour program implementer training. So let me see, I know we are just about out of time here, but somebody requested they wanted to take a peek at the elementary school version of sport. So let me see if I can pull it up really, really quickly, at least pull up the PowerPoint slides so that you can just take a look at what the difference is between the, well, I guess we were looking at the middle school version. And now let's take a look at the elementary school version. And here I'm pulling up the elementary school version of the slides. And so now let me see if I can grab onto that slide. There it is right there, pull it up. So here it is. Here's the elementary school version slides. And you see, again, introductory slide or initial slide, complete the fitness, health and fitness survey. The survey questions are a little bit easier. You just answer yes or no. And then the main difference is the content and the images. There's the images. You don't have you don't have young adolescents, you don't have older adolescents, you don't have young adults, you have elementary school kids, and so lots of positive, images of kids engaged in healthy behaviors, both genders, different ethnicities, eating healthy, lots of great pictures. And as I said, there's some flexibility that you can tailor these slides, particularly images, if these pictures aren't representative of the kinds of kids you have in your organization or your region. Okay, so that is it. Let me just double check one more time. Make sure I didn't miss any questions. What's the 1 month follow-up? 1 month follow-up, I don't know. I don't know what the 1 month follow-up is. I'm not sure. That's a good question. Again, the follow-up could be presenting the parent flyers. It could be this, and we discussed this as well during the program implementer training, how you can follow up if you want to do more with them beyond a single session. How do you get access to the pre-post test link for virtual teaching? Well, that comes with the program, and then we do the training, And then during the training, we discuss it, and we could send you the links. We could send you a customized link. So let me see, this is from Anonymous. So Anonymous, why don't you send me a request at info@preventionpluswellness.com, or you could just follow up with my email to everybody. And then you could say, hey, we've purchased this program. We'd like a customized link for our organization, or just pick up the phone and give me a call. I'm happy to help you with that. And our number is 904-472-5022. So thank you everyone for participating. I'm sorry if I didn't get to your questions. I really have to shut it down at this point, and God bless you for all you do. I will follow up, send you all a certificate for completion today, as well as a link to this recorded session. Thanks everybody, have a great afternoon. Take care, be safe, keep up the good work. Bye-bye everyone.